Hey guys, welcome back in our YouTube channel in which we are studying about trigeminal nerve, and today's our topic of discussion will be the mandibular division of trigeminal nerve, which is the third main division of trigeminal nerve. As in previous section, we have discussed about the other two divisions of trigeminal nerve, which are the ophthalmic and maxillary division of trigeminal nerve. The mandibular division, which we are going to discuss today, is a mixed nerve. It's largest from other two divisions, and it's mixed because it formed by the union of small motor and large sensory root. So this mandibular nerve is mixed because of its sensory and motor root. This here is a diagram showing that sensory root arises from the third peripheral division of the Gasserian ganglia, trigeminal ganglia, and motor root arise from the motor cells in the medulla oblongata. Motor root run along with the sensory root, passes below the semilunar ganglia and run side by side. This sensory root but not join. They both pass through the foramen ovale to leave the middle cranial fossa, then join to form the single trunk, and after running a small course, it divides into two divisions, anterior division and posterior divisions. This sensory supply of this nerve is to dura. As I have discussed before, all three divisions of trigeminal nerve give one dural branches to the dura mater, and then its a sensory supply is also to skin and mucous membrane of chin, cheek, and lower lip. Then external ear, parotid gland, TMJ, scalp over the region of temporal bone, and then lower teeth and gingiva. And its motor supply to muscle of mastication, mylohyoid muscle, anterior valley of digastric, tensor valley balti, and tensor tympani. As the dura mater, the sensory supply is given by its dural branch, which is the nervus spinosum, and skin and mucous membrane of chin, cheek, and lower lip are supplied by its posterior division. Then external ear, parotid gland, TMJ, they are also supplied by its scalp over the temple region of the temple region. They are also supplied by the posterior division, auriculotemporal nerve, which is a branch of posterior division. Then lower teeth and gingiva by inferior alveolar nerve, which is also the branch of the posterior division of the mandibular nerve. Then is motor supply to muscle of mastication, mylohyoid, extra. These are by the anterior branch of the mandibular division of the trigeminal nerve. So both divisions supply sensory and motor supply to the various parts of the face. Branches of the mandibular nerve are branches from the first of all main trunk, the meningeal branch and up to medial pterygoid. Then branches from the anterior trunk are the buccal nerve, mesenteric nerve, deep temporal nerve, and up to lateral pterygoid muscle. Branches from the posterior division are the auriculotemporal nerve, lingual nerve, and inferior alveolar nerve. Here is the diagram showing the complete course of the mandibular division of the trigeminal nerve, in which we are seeing this green line, which is the peripheral division, third peripheral division of trigeminal ganglia. This is the sensory root, sensory part you can say, motor part coming from the motor cells which are present in the medulla oblongata. Both nerves, sensory or motor fibers, both fibers run side by side. Motor fibers pass below the semilunar ganglion, run along the sensory part, though both side by side, crossing the foramen ovale, and just after crossing it, they join to form the single trunk. So then first sensory branch arises from the single trunk, which is the meningeal branch, that is the branch to dura mater, and this branch has the name nervus spinosum. And this nervus spinosum then entered back into the middle cranial fossa through the foramen spinosum to supply the dura mater. Then second branch, which is the motor branch, arises from this single trunk, are the nerve to medial pterygoid. This nerve to medial pterygoid supply the medial pterygoid muscle, and also some fibers pass through the tensor tympani muscles and tensor variae peltae muscle. Then the single trunk course further forward and divide into two divisions. First is anterior division and then posterior division. Anterior division supply the mainly muscles of mastication, and then posterior division have three main nerves. First is auriculotemporal, then lingual, and then inferior alveolar nerve. And when it giving the inferior alveolar branch just below, with that, it also give a nerve to mylohyoid muscle, that is the mylohyoid nerve. So inferior alveolar canal enter the mandibular canal, inferior alveolar nerve enter the mandibular canal, and nerve to mylohyoid run downward. Now I am going to discuss each nerve turn by turn. First of all, we are going to start from the anterior division of the divided mandibular nerve. The first nerve is nerve to external pterygoid or lateral pterygoid muscle, which enter the lateral or external pterygoid muscle from the medial side. Second is the nerve to temporalis muscle, which are the two nerves, anterior deep temporal nerve and posterior deep temporal nerve. Anterior deep temporal nerve passes upward and crosses the infratemporal crest of the sphenoid bone and enter the deep part of the anterior portion of the temporalis muscle. Then posterior deep temporal nerve runs upward to the deep part of the temporalis muscle. Then the nerve to the masseter muscle. Nerve to masseter muscle passes above the external pterygoid muscle, then enter the mandibular notch, and from that it enters the deep part of the masseter muscle. Now come to the buccal nerve. Buccal nerve run downward anteriorly and laterally between the two heads of external pterygoid muscles. At the level of occlusion plane of the mandibular second and third molar, it divides into several branches to supply the buccinator muscle. The nerves from the posterior division of the trigeminal nerve, that is first of all is the auriculotemporal nerve. Auriculotemporal nerve arises by the two roots. One is medial and then lateral. These both roots embrace the medial meningeal artery and join behind it and passes posteriorly deep to external pterygoid muscle. And then between the sphenomandibular ligament and neck of the condyle, then it traverses the upper deep part of the parotid gland, and after that it crosses the posterior root of zygomatic arch, run in upward course along with superficial temporal branches, and give to trachea of the pinna of the external ear, scalp about the ear, and buttocks of the skull. So, branches of the auriculotemporal nerve are mainly communication branches of auriculotemporal nerve. The communication branches have the communicative fibers, and these have the postganglionic parasympathetic secretory fibers. And second are the communicating branches of postganglionic sympathetic fibers. And third one is communicating branches to facial nerve, which are the sensory fibers. So these three types, parasympathetic, sympathetic, and sensory. Postganglionic parasympathetic, postganglionic sympathetic, and sensory fibers go into the parotid gland. The parasympathetic fibers, secretomotor fibers, they are postganglionic because their preganglionic fibers are from the glossopharyngeal nerve, and there is the otic ganglia, and from otic ganglia fibers run into the auriculotemporal nerve, and then communicating branches of postganglionic sympathetic fibers also go into the two roots of the auriculotemporal nerve and then into the parotid gland. Now, the other branches of auriculotemporal nerve are the branches to parotid, auricular, medial, and articular and terminal branches. So these are the auricular temporal nerve. Now comes to lingual nerve. Lingual nerve is a smaller nerve, and it also arises from the divided portion from the posterior division of the mandibular nerve, and it is smaller and passes medially to the external pterygoid muscle. Then it passes medially, then it runs downward between the internal pterygoid and ramus or mandible in the pterygomandibular space, where it lies anteromedial to inferior alveolar nerve, and it also gives a small branch to inferior alveolar nerve which supply the tonsillar region. Then it passes deep to the side or base of the tongue, where it lies below the lateral lingual sulcus. Here it separated from the tongue by alveolingual groove, and then it runs downward and immediately beneath the submandibular duct. It gives sensory fibers to mucous membrane of the floor of the mouth and gingiva on the lingual side of the mandible. Then branches of the lingual nerve. First is the communications of lingual nerve with coda tympani branch of the facial nerve, as the nerve passes medial to the external pterygoid muscle. Comes to the inferior alveolar nerve. It is the largest nerve or largest branch of the posterior division of the mandibular nerve of the, which is a branch of trigeminal nerve. It passes downward on the medial side of the external pterygoid muscle and the medial side of the mandibular ramus. And then it gives first mylohyoid branch before entering the mandibular foramen, which run downward and forward in the mylohyoid group to supply the mylohyoid muscle. It has both sensory and mixed sensory and motor fibers. Then it inferior alveolar nerve enter the mandibular foramen and run in the inferior alveolar canal. At the level of the bicuspid, there is a mental foramen from which is one branch, that is mental branch, comes out to supply the lower lip, skin of chin, and further it continue forward. The inferior alveolar further continue forward as an incisive nerve to supply the central incisors. So this is all about the mandibular division of the trigeminal nerve. Hope you all understand, and if you have any query regarding this, you are free to ask. Thank you and have a nice day.